An aura is a sensation experienced by a seizure patient right before the seizure, which may be a smell, sound, or general feeling. Diabetes mellitus, also called sugar diabetes or just diabetes, is the condition brought about by a decreased insulin production or the inability of the body cells to produce insulin properly. The person with this condition is a diabetic. Diabetic ketoacidosis is a condition that occurs as the result of high blood pressure, characterized by dehydration, altered mental status, and shock. Epilepsy is a medical condition that causes seizures. A generalized seizure is a seizure that affects both sides of the brain. Glucose is a form of sugar. The body's basic source of energy. Hyperglycemia is high blood sugar. Hypoglycemia is low blood sugar. Insulin is the hormone produced by the pancreas or taken as a medication by many diabetics. A partial seizure is a seizure that affects only one part of the side of the brain. Postnoctal phase is the period of time immediately following a tonic-clonic seizure, which the patient goes from full loss of consciousness to full mental status. Reticular activating system is a series of neurological circuits in the brain that control the functions of staying awake, paying attention, and sleeping. A seizure is a sudden change in sensation, behavior, or movement. The most severe form of seizure produces violent muscle contractions called convulsions. Sepsis is an infection, typically a severe system-wide response to infection. Status epilepticus, a prolonged seizure or a situation when a person suffers 2 or more convulsive seizures without gaining full consciousness. Stroke is a condition of altered mental function caused when an artery in the brain is blocked or ruptured, disrupting the supply of oxygenated blood or causing bleeding into the brain, formerly called a CVA. Syncope is fainting. A tonic-clonic seizure is a generalized seizure in which the patient loses unconsciousness and has jerky movements of paired muscle groups.